Hi everyone, this is Meenal and I'm working as a dental therapist and hygienist in London. And I have given my ORE part 1 and I'm waiting for the booking of ORE part 2. So I'm making this video just to guide few students who know nothing about ORE, and like I had to contact many of my seniors and people around me who were giving ORE to get all the information. This video is not in depth. I'll certainly make a video of each part in depth, but this is just an overview. Okay, so if you're a dentist who want to work in UK as a dentist, this exam is definitely a golden ticket. Before giving the ORE, there is a lot of paperwork. You can even before like think of the exam, you need to collect a lot of documents. You have to deal with a lot of paperwork, which is tough, but nowadays they have start taking the processing fee, which has decreased the time amount of time they're taking for per application. Which means before, when I was submitting my documents, they didn't took any fees, but like they really took 4 months, 5 months. But now they are taking 96 pounds, and now they have started if your documents are correct, they have like they're taking less time. Okay, so there is an application package. You have to go to the GDC website in that route to register in ORE, fill the details and download the form, and like all of the other documents whichever are required, I'll tell you in next slide. You have to attach that and send it to GDC, right? But before downloading the form, I would really want you to arrange all of the documents and then download, because once you download, you have just 45 days to complete your form. Otherwise, the form will expire. Yeah, this is one thing. So, what do they do? You submit a document, they verify all of your documents. You have to create the account. If the GDC verifies your document, you'll get the email. You have to contact them through email mostly, and then you can book your exam. So, but like in the starting, when you fill out the form, there are a few documents you need. I'm just calling out the name, and we can know in next video like the depth. Okay, so in the application package, you have to fill your basic information. There are two more important things. One is character referee form, and one is clinical experience form. Clinical experience form is filled by your colleague or one who has supervised you, like your HOD or anyone from your college, any professor who has seen you working, and they should fill that form. You need their signature, email address, because like when they'll process, they are gonna contact your clinical referee. Okay, and then there is character referee form. You have to fill this form also. Character referee can be anyone who knows you from like 1 year, I guess. All of the requirements are written there. You have to go through that, and then you need to fill that form. I hope this is clear. And these two things, like these three things, basic information, character referee, and clinical experience, you have this in the form only. But along with that, you have to submit your passport, degree, photograph, character of good standing. So let me tell you, not the original. You need to certify all of the documents like passport, degree, and onto the photograph on the back side, your referee needs to sign. These are small, small things you need to know. I need to really make a separate video for that, because this one is just the short one. Okay. Uh, and good certificate of good standing, you have to ask from your state dental council to give. Like I am from Madhya Pradesh, so I have to fill a form online, and then they provide you soft copy, hard copy. So it's better to have the hard copy so that you can attach and send with all of the documents. And IELTS test report. So if you have like recently graduated, like in 2 years, you don't need IELTS test report, okay, because you've recently graduated. But your course should be in English, like all of the dental teachings, which is in India, I guess, yeah, in all of the colleges, yeah. So, but like for me, I passed in 2018, so I have to give the IELTS test. So I gave this test, and then there are certain scores you need. I guess overall it's 7 and 6.5 individually. Just cross check it, okay? And then there is this NARIC certificate. This you need to apply online as well. They'll ask the transcript. Transcript is nothing but like you have to write the application to your college people. They'll provide you all of your 4 years ranking in two sheets. Okay, so total score of 4 years. It's easy. Just apply, like talk to someone in your college. They'll do that. Okay, so in NARIC they'll need this transcript. For NARIC you have to go online and visit this like NARIC certificate. So NARIC certificate is basically a degree which tells that your degree in India is equivalent to UK dentistry. Okay, so they need this, and also they'll need few more things. Everything is written on the website. You can have a look. So in short, you have to make a package in which there would be the application form consisting of these three things: and passport, degree, your photograph, your certificate of good standing, IELTS if required, and NARIC. Okay. Other than that, when you send it, you have to send it to the GDC address. GDC will verify your documents, and then they'll contact you through, as I told, email, and they'll ask your clinical referee to confirm that you have the knowledge, and you have like completed a certain amount of hour. I guess it's 1600 given, but you can always check. Yeah. And then once they confirm, they'll give you a link to make your account. You have to make your account, and on the booking day there would be a tab visible, book now, in the same account. Okay, I hope this is really easy to understand, not to do. The next slide is like how is like the exam. So you can only give the exam in UK, London. It is a computer based, it has MCQs and EMCQs. Subjects, like all of the subject of 4 years will be asked in this, but few subjects will have more weightage and few will have less. Okay. The exam is gonna take place in two days. Like, let me tell you, ORE has two parts, part one and part two. Okay. In part one, there is paper A, paper B. So paper A will happen, let's say today. So paper B would be tomorrow, okay? Or in few batches, if the paper B is today, then paper is A is gonna like be tomorrow. So in paper A, they ask the basic subjects like anat, micro, physio. Paper usually the subjects of first and second year. And then in paper B, they'll cover the clinical subjects, perio, ortho, prosto, and also ethics. Ethics and rules of here UK are a bit different, so we need to study. And then the exam is gonna be 3 hours each day, 200 question each day, so total 400. Um, so and the passing score will be 50% in separately. Paper A, it's not like if you get and there's no negative marking. And like if out of 200 you have, let's say you have in paper A you have 130, okay, 200 of like 130 out of 200. And paper B, let's say you have 90, so you're not passed. Maybe the total is more than 200 out of 400, but you need to pass individually, like. Okay, and then yeah, it's tiring. So the part B, which I'm supposed to give, has DTP. Like you have four parts: DTP, clinical examination, which is OSCE, mannequin, and emergency. So in DTP, they implant a patient, like act a patient. He presents the case that, I have this problem, I have that problem. So you have to take the history, proper dental history, medical history, social history, all of the things, and then you have to tell him what investigation we require. Then you present the case in front of the patient, like as you are telling him like what are the pro and cons. That is all about DTPT DDB. So it is a 1 hour exam. And then there would be just one case, 1 hour. And then clinical exam OSCE, they put 16 stations. A few of them are like actors, and in each station, and is like you get 15 minutes. Few of them are actors, few of them are written OSCE, and like this, the and few of them are like skilled OSCE. Like they'll tell you to give two sutures in 5 minutes and splinting and all. We can discuss it later. This also. So the clinical examination takes place. The one is that, and one is mannequin. The other is mannequin. Mannequin is like they'll give you a proper mannequin, and they'll tell you to prepare class two or maybe PFM. They'll give you two or three exercise, two major, one minor. They have this combination, and they'll give you. They have written in their GDC website also, like what they usually give, like out of what we are gonna get the exercises. Okay. And the fourth is emergency, medical emergency. So of course, if a patient, panics in the any medical emergency, like fainting or hypoglycemia, anything like could take place in the clinic. That's why they take this exam. And the exam would be hardly of like 15-20 minutes. They will tell you to perform certain activities like CPR and all, and then they'll ask you questions. Hope it is clear. So this is about part two. About the preparation. So few of them decides to self study. Of course, it's not like you cannot clear the exam by self study. If you are thorough with learning and you have a good planning, definitely self study you can always do. Plus that, please follow like WhatsApp group, add in the WhatsApp group, free WhatsApp group and free Facebook group, so you can know like what are the questions which comes, and you can study accordingly. Okay. And the second is joint courses. They'll provide you proper study material, proper video, and then discussion class, doubt session. You will have the direction, and you'll know that you're going in the right direction. You'll have the mock. So it's not you, if you don't join the course, you're not gonna clear. It's not. Many of my friends did self study and they like cleared the exam with me, and I joined few courses which were really helpful. And yeah, so like I passed my ORI part one. So this was about the self study and of course joining the courses. So you can give 4 attempts for each part. If you fail, like 4 times, you can't give the exam. And if you have given the ORE part one, you have to give ORE part two within 5 years. Okay. Then once you clear all of the exams, you can register to GDC, and then you can practice as a private dentist. If you want to work with the government, then there is a separate procedure. We can discuss it like later. And then they have changed the fees. This part is really important. ORE part one is 584 pounds. ORE part two is 4235 pounds. Harsh. And if you repeat the exam like ORE part 1, if you fail, and if you give the second time, you have to pay 584 again. If you give ORE part 2, if you like, I hope not, but like, um, suppose if you like take, if you fail in mannequin, you have to give all, like if you fail in mannequin, you have to repeat the exam. If you fail in DTP, you have to repeat the exam. If you fail in, like let's say OSCE, you have to give the exam. But if you fail in medical emergency, you have to just pay 566 and like do the just medical emergency part. You don't have to do all of the four exams. So you don't have to pay again 4 to something something. Okay. And then